Welcome back. We are on episode 5. I'm Dr. Rob, your host, and you're watching Success Stories. Today we have a very exciting guest, a businesswoman, a very successful chiropractor here in the Philippines, and a health enthusiast. So we have a lot of great things that we're going to learn today. It is my dear friend, Dr. Jill Chapman.
Hello, thank you for having me today.
Yes. I think it's important for everybody to know a little bit about, us, and you actually work with us at our Doc Robin Associates branches. And so I started recruiting you, I think in what was it, 2016, 2017 to come
Yes,
here,
yes,
correct?
shortly after you opened officially here.
Right. So when I came here, I was just kind of seeing people out of my condominium, and then when we rented a townhouse, so we just started seeing people at our house, and then we decided to start our own clinic, and it just exploded. And I was taking care of so many people, I couldn't really keep up. So I was really recruiting my good friend Dr. Jill, who was in San Diego at the time, to come and help me. Right? You remember that? I'm like, come and
Yes,
help me. You're gonna love it here. Right?
yes, I remember you asked me so many times,
Yeah.
and at the time I had my own practice and I was busy and I there was no way I could break free from that
Right,
in
of course.
2016.
I mean, it's so hard. People always say, "Well, why don't you open a clinic here and here and here?" Well, it's not easy. First, getting doctors to move here, and then getting great doctors. It's very difficult because, of course, people have lives in these other countries. So you were quite busy with your other clinic, and it just didn't work out at the time. But finally, kind of the stars aligned, and you were able to come. That was
Yes,
2019.
yes, 2019.
Right. I remember we picked you up, and we had a speaking engagement at the Department of Health, and you were on stage within 10 minutes accepting an award.
It was yeah, whirlwind. Yeah,
Right.
yeah. You really introduced me to the Philippines with a bang. With yeah, so that was one of the reasons I just completely fell in love with the place.
Yeah. I think, people don't really appreciate or know how hard it is to see a lot of people. Right. And we were seeing so many people because we just had our Quezon City branch, we had our Makati branch, and you were like a rock star. You were seeing so many people. It was quite amazing. I'm so impressed by that.
Well, thank you, thank you. And that was one of the obstacles I remember you telling me that. Well, I'm seeing XYZ amount
Yeah,
of
we were seeing
patients
like
a day.
1,000 a week in our Quezon City branch alone. And so you were seeing like 300 a week, which is a huge
Yes.
number.
Yes, for a female, and I was 49 years old when I first came, and
Yeah.
I was used to seeing maybe 20 patients a day and taking my time. And yes, it was a whole different experience coming to work with you.
So what is it like? What do you think? Why do you think that we've been able to be so successful here?
Well, I think number one, it's you, your vision, and your heart. I mean,
Hmm.
you watching you and all the doctors, all the staff, all the patients will back me up on this. Watching you work with a new patient or even doing speaking engagements, I mean, it comes from your heart. It's not fake. It's
Yeah.
it's it's real.
Yeah.
And people feel that. And so, of course, that I mean that's why I really liked you from the beginning in chiropractic. You're a real person, even though you look like Captain America. You're real, and that equates into your hands, and you give healing power through your hands and help people, and
Yeah.
people see that and know that. And so, working side by side with you, especially, I do miss that. When I first came, we were working together at least 4 days a week, and just the energy that you had, I felt, and again was able to transfer to the patients, and I
Yeah.
think that really blossomed.
People call you like the Doc Rob female, right? Which is, I mean, that's great. Like, I mean, I think, yeah, I'm so excited. I'm so excited to tell people about what we can do for them and how we can change their life. And I think that fired you up, like seeing that, right? Being around
Absolutely.
that. And then when you help so many people, right? It's like I try to tell my kids and my wife, of course, she's performed in front of thousands of people, and so she knows that feeling, that high. And after a Sunday, that's what I tell them. It's like that. It's like performing in front of thousands of people. Your adrenaline is just through the roof, right? It's like you don't feel that in America, right? When
No,
we practiced in
no,
America.
no, no, not at all,
Yeah.
not at all.
So here we just have like the kind of perfect storm. We have Patricia Javier, the marketing, got me on TV, got me adjusting the celebrities. And of course, when you deliver an amazing service and you help people and it's real, of course that just spreads, the message spreads. And so, you did such a great job of kind of fitting in and just really learning everything that I do and say and kind of mimicking, and you have just blossomed into really well-rounded chiropractor here, and you're becoming quite well known as well, right? People have
Yes.
asked for your picture.
And I do get recognized at times, and it's always kind of funny.
Yeah, it's a cool feeling, huh? Like, because in U.S., of course, we don't get people to ask for our picture, but even in the clinic, right? People are, oh, Doc Jill's here. They're so excited to get adjusted by you because Doc Jill is a phenomenal adjuster, and that's why I wanted her to come because it's really hard to find really, really good chiropractic adjusters.
Absolutely. I 100% agree.
Yeah. So, where did you learn to be such a great adjuster?
Our school, Palmer West in San Jose, California. That's where we met and went to school together. And we were just given from, gosh, our first quarter in school, we had hands-on people touching
Yeah.
their spine, all the joints in the hands, and we were learning then correlation, anatomy, physiology, the neurology. Everything was so perfectly correlated together that it was just ingrained in us. And then once we got to the point of actually adjusting the students, ourselves, on the doctors, on other patients, it was just repetition, 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 and having such good clinicians also standing right beside us and telling us, no, maybe do this, do this, do this. Because again, you've said this so many times, it's so fast, and so it seems so easy. What
Right.
we do is so simple, but I mean, depending on where we're adjusting, it's like 2 degrees anterior, superior, supine, and we're lining up our bodies to deliver that precise, perfect
Perfect. Yeah.
adjustment, right?
Mm-hmm.
And some people don't see that, especially, people that try to mimic here.
Right.
That, oh, it's just so easy. And you do the same thing every time. Like,
Yeah. No, we're doing a
keep
different
that.
segment.
Right,
It
right.
looks like we're doing the same thing, but we're doing a different segment.
Exactly.
And I think we should touch upon that. Our schooling was 4 years. It's not like a 2-week program just to learn to crack the back,
Right, right,
right?
right.
I mean, I thought our school did an amazing job, for the first several months, even a year, like before we even started adjusting. We just were doing palpation. We have to identify what is normal and what is not abnormal. And so we're identifying the subluxations or misalignments. So we learn, first of all of that. And then, of course, all the, the physiology of the body because we have to diagnose. So I love that. I love chiropractic school. It was the time of my life.
I agree. I agree. It was tough for me. I didn't have a science background, so I did 4 years of college, then I did 2 additional years just for sciences, and then that's when I went to chiropractic school after that. So it was a
Yeah.
lot of schooling for me.
Yeah, so you were how old when you started chiropractic school?
26.
Okay, so I finished at 27 because I just went straight through. So you had some stuff in between.
Yes, I
Yeah.
graduated at 30.
Yes. So let's talk about, what it is that you do here in the Philippines because you obviously are very fit and you're very healthy and you don't mind saying how old you are?
No, I'm 55 years old, and Um, you'll hear this all the time from Doc Rob. It's just consistency, and it's simple. I mean, you just do repetition, repetition, repetition. So, of course, I work out. I like to lift weights. I think that's the easiest way, the quickest, the easiest way to get in shape, feel good, get strong. But also, I do yoga. I do a little bit of boxing. I do paddleball. I just like to be active every day,
Yeah,
no matter if it's a 30 minute, an hour walk. I do something every single
right.
day. And then I try to eat just clean food, lean meats, vegetables, fruits, anything in a box, a can, a bag. That's has chemicals inside, so it's really good to stay away from that. So I do my best to try to do that. And here, I've done the stem cell services that you offer. I do the drip therapies, the drip infusions, especially the anti-aging. And now also the hyperbaric chamber. I absolutely love that. I'd like to sleep in there like Michael Jackson used to.
Yeah, and that's what, when I came here and I just kind of wanted to set stuff up for like what I do. Like I want to get adjusted and a chiropractic adjustment should just take a few minutes. So I set up my clinics just like that. You go in, you get an adjustment, and you leave. And then we learned about the vitamin infusion and the powerful, these ingredients that you can flood your body with, and it's 100% absorption. So we got the anti-aging drips, we've got detox, we have immunity boost. So we have these different drips that are going to certainly enhance your health and hopefully slow the aging. We also have the stem cell therapy, which some people do every year or every 6 months. And that's obviously, cutting edge technology to really help with anti-aging, but also autoimmune issues. And then, lastly, we've introduced the hyperbaric chamber. And that's obviously when you're breathing in that oxygen at that, pressurized state, it's just really basically strengthening every single cell in your body. And your mitochondria, everything is becoming stronger, cellular membrane, and again, anti-aging, autoimmune issues, diabetes. So I just wanted to set up this one-stop wellness shop for everyone so that they can stay as healthy as possible, live as long as possible, feel good, while they're alive and playing with their children and their grandchildren. And so I'm very proud of what we've created here. And I'm so glad you're along for the ride with us. So I'm glad you're also taking advantage of all the services, and you can obviously tell it's really working for you.
Well, absolutely. I go home to the US about every 6 months-ish or so, and my friends always ask me, "Oh my gosh, did you get a facelift?
Yeah, you've
Did
definitely
you?"
gone back in time.
Yes, I'm always saying, no, 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 I'm just doing everything that I can do to reverse the aging process. And you've made that so easy by bringing the drips in-house, the stem cell in-house, and now the hyperbaric,
Yeah.
which again, like you said, it's just so good for your skin, for at the cellular level, the mitochondria. It's incredible what you've done. So thank you for bringing me here and
Yeah.
making me a part of this.
Yeah, but and then the consistency, like you touched up on earlier, you're very consistent. You exercise almost every day. You obviously eat very well, small meals, whole foods, and you've been doing that for a long, long time. Even before in San Diego, you ate rather well. So that consistency is obviously such a huge deal.
Absolutely.
Yeah. So one thing that's happened to you while you've been here, which was a huge, awesome thing you did, because it really took you getting out of your comfort zone. You did a beauty pageant, which is like the farthest thing from really your personality. So
Absolutely.
what happened there?
That was in 2019 when I first arrived. Your wife, Patricia Javier, was a part of the Noble Queens, and she recruited me to also participate in, yes, a beauty pageant, but also having very strong community advocacies. So helping people was at the paramount of this pageant. It wasn't just who's the prettiest, who can, smiles the best, kind of thing, which that interested me. So in addition to helping community, and we did so many community service activities, we still do to this day. There's another one Sunday with your foundation, now that you have the Doc Rob Share Your Blessings Foundation, that I think was a branch of that. But yes, the beauty pageant was amazing. Definitely got me out of my comfort zone. I really don't like to be in the spotlight at all. I don't like to be on stage. So that did bring me out of my shell. So little by little, I'm trying to become more comfortable doing such things like this, and having my photos taken and have video.
Yeah.
So yeah, I don't love that part.
I remember there was a time during the competition you wanted to quit, right? So
I did.
Let's talk about that.
I
Because that's good, because a lot of people don't realize that happens all the time. We want to quit things when things are tough, right? Because we're scared. It's really deep down fear.
Yes, yes, I
Right?
was scared. I was scared of failure. I was scared of making a fool of myself. All these women they're so gorgeous, and they can walk with grace and skill in 6-inch heels and hold their head up high and just look fantastic, flawless. And me, I always think of myself as kind of like a 16-year-old boy like this. And I just remember I was crying in the back, like, I can't do this. And your wife said, no, you can. Come on, you
Yeah.
can do this. You can do this. You're Doc Jill. You can do this. So yes, so she saved me that day, and luckily, yes, I'm very happy that I did it.
Well,
So
and that's what the great thing when you have a support system and then you just dig deep and you just got to get tough and you just got to do it. And it's so amazing you didn't quit. Could you imagine if you quit? That would have just haunted you forever. So
forever.
you sucked it up, you did it, and you did well, and you got a title, and now you are part of that organization and you help out. So that was an amazing time in your life.
Yes, yes, I'm very happy I did it.
As your friend, I was just so proud of you for finishing that and, getting out of your comfort zone because I'm a big believer in getting out of your comfort zone. That is how we grow, right? If we just stay in a comfortable position, we don't grow our
Right.
whole life, and it's like analogy with muscle. To build muscle, you have to stress it, you have to work it hard, and your muscle grows. Well, that's the same thing with us in our life. We need to push our boundaries if we want to grow. And so being, success topic, I just think that's important to point out how you've really blossomed here in the Philippines because you've taken these chances. First of all, coming here was a huge risk.
Mm-mm.
So that was getting out of your comfort zone. You moved to the Philippines at the age of 40,
49.
49 years old, and then seeing so many people, that's not easy to do where your body's breaking down. I remember you telling me, Rob, my body's really hurting. This is really tough.
And that's when I took the first stem cell therapy,
Yeah,
and it was
it helped
just
your fingers.
amazing.
Yeah.
Yes,
And then
yes.
the Noble Queen. So getting out of your comfort zone is obviously very important. So that's a good lesson for our viewers, huh?
Absolutely,
Yeah.
absolutely. If you're getting out of the comfort zone, like you say, is a growth opportunity, and also confidence building too.
Yeah, it's just everything snowballs. Your confidence is higher. You're radiating at a higher frequency. You're
Mm-mm.
attracting better things into your life. You feel good. Your dopamine is high. Your serotonin levels are high. You're then exercising. It's just the snowball effect, and that's just it's great. I love that.
Mm-mm.
That you did that. So, let's touch upon you had a successful chiropractic clinic at one time in San Diego, right? I remember you
Yes,
were seeing a
yes.
lot of people, helping a lot of people. What did you do? Because I know it was not easy. So tell us about like what you did to become successful there.
Oh gosh. Well, I was in many networking groups. Owning your own business, as you know, it's not an 8 to 5 job. It's more like 24/7. You're always thinking about what else can I do? Where else can I be seen or just spread my message. So I was doing many different networking events and hosting blood drives and oh my
Yeah, I remember
goodness.
you didn't you do like some really cool like spinal screenings
Oh
and
yes, yes, that's right. Yes, at the malls near my clinic, we would go to the mall like for 4 or 5 hours and do spinal screenings
yeah.
and just talk to anyone and everyone about what we can do to help people naturally rather than taking medications and
Hmm.
the normal allopathic mindset, trying to change people's minds in that way. So yeah, spinal screenings and just posture analysis and just showing people that how your body affects your organs and thus your pain levels. I mean, that's really a common thing in the US and even here at times. People come to us for headaches and back pain, but chiropractic is so much more than that because the spine houses our nervous system, and unlocking those misalignments, those subluxations, allows our nerves to function optimally. Therefore, everything in our body functions optimally. We feel better, we're out of pain, but also our heart is functioning better, our lungs,
Yeah.
everything. Lahat.
Yeah, so you were doing these networking groups, you were doing the spinal screenings, really, and that's what we have to do in America. We have to get out there and educate people about our what we do, our clinic, so that
Mm,
we could get business. So
exactly.
you worked really hard. I remember you doing a lot of those screenings and setting those up. So it
Oh, yes.
takes a lot of work to
Definitely.
to build a chiropractic clinic in America. Were
Mm-mm.
you always very competitive?
Yes, yes.
Because it seems like you're pretty competitive.
Yes, as early as 4 years old, my parents put me onto the swimming team. So yes, always athletic and doing something competitively. Yes,
But what was your
definitely.
best sport?
My best sport, I guess.
Were you good at volleyball?
I was okay.
Yeah.
I thought I was better, but
Because you're tall, so
the
you think you'd
college,
be pretty good.
I did try to walk on to the collegiate level, and everyone just towered over me, and they dismissed me. No, no, I
Yeah.
wasn't
How about
tall or good
swimming?
enough. I was good at swimming, but I didn't like to be cold, so I did eventually let that go. I think my best sport was track and field events, more like the field type things because I'm strong and
Yeah. Shot put, javelin,
yes,
discus,
discus.
throwing
Yeah.
objects.
Yes, exactly.
Yeah.
Yeah, because I'm a large person.
So, what do you think is next in store for you for these next few years?
Oh wow. I'm happy being here. My role with Doc Rob Chiropractic now, I assist in allowing the doctors to take time off. So I transfer between clinics now, and I do love that. I love seeing the patients have their or me deliver an adjustment, which is so ideal, and I love seeing the spark in their eye, like, wow, what did you do to me? So I love that. So the next few years, I see myself doing this. Wherever you send me, I'll be there.
Yeah, so right now you're really helping out at the other branches, and so it's nice because I've heard that when they see you, it's like, oh, Dr. Jill's here. They're very excited because they love you.
Well, yes, and I do try to stay out of the videos, but I am in a few of the
Oh
videos.
yes,
And so they're excited because they feel, I think they already know me a bit. And it's kind of cool that they're excited to see me and
of
be
course.
adjusted by me.
Yes, of course. So if you could give some tips or some advice to somebody, to people out there, what advice would you give to them to become successful, an entrepreneur, a business person?
Well, you have to do what you love. It can't be about making money because if it's only about money, it won't be fun. And I mean, you can do that to a point, but it's not gonna be the driving force to as what gets you out of bed and what you're excited about that day. So you have to love what you do. So find a passion, find what you love, and find out how you can make money from that and just follow through. You have to have a plan, of course, and
Yeah, consistency,
consistency.
hard work.
Absolutely, because nothing's easy. Everything's an uphill battle, and you can't give up. You can't. You have to keep going and just figure out how to get over that next obstacle, the next hurdle, the next thing. And it has to be broken down. You can't say, I'm gonna be a successful business owner. Well, there's a lot of space between that, and you have to just kind of break it up into chunks.
Yeah, so it's not so overwhelming. First, identify your passion, and then
Exactly.
you need to align your body with, or your life to achieve that. Right.
Absolutely.
Well, I'm Patricia and myself. We're obviously so proud of you because you have just done so well here, and we're so happy you love it here and want to stay here.
Well, I can't thank you guys enough for inviting me here and working with me to allow me to
Oh
be a
yeah,
part of this,
oh, yeah, and
what you've
thanks.
created.
And for being on this podcast, it's great for everyone in the Philippines to get to know you more because you're becoming quite well known here. So we'll have to do another episode here
Okay.
in a 6 months or a year just to check back in on you. Okay.
Okay. Well, thank you
All
for
right.
having
You're
me.
so welcome. Thank you guys. Okay. We'll see you on episode 6.